Welcome to another episode of Wellness and Wonder. We've been fortunate to have some amazing guests so far, but I have to say I'm really excited about who I'm talking to today. On this episode, I get to speak to Cactus, a company that is synthesizing strategic consulting, architectural design, and digital product development into one focused offering. Specifically, I'm excited to share how they're merging these endeavors to pioneer a smarter, calmer, and more human approach to healthcare experiences. Just one example that we discuss in depth is their hybrid clinic and research center project called Lab 100, which was built in collaboration with Mount Sinai, located in New York City. You'll hear from co-founders Noah Waxman and Marcelo Pontes about how this facility fuses ambient technology, intuitive architecture, and digital storytelling into one seamless patient experience that you can actually understand. This project and many others shows us how Cactus is fundamentally rethinking what healthcare feels and looks like. With clients like Mayo Clinic, Advent Health, and Wellstar, they're reshaping everything from hospitals to digital platforms. It's no wonder they were just named one of Fast Company's 2025 most innovative companies in the design category for redesigning the entire experience of healthcare. So if you've ever thought, there has to be a better way, well, Cactus is already building it. Noah, Marcelo, good morning, gentlemen. Great to have you here on our Wellness and Wonder podcast series here, sponsored by Bialik Environments. We're very excited to have you both be guests on this episode.
Good morning. Psyched to be here, Raj.
Yeah.
Thank you.
Fantastic. We've had some conversations and sort of getting ready for this discussion, and you are well aware that we are very, very big fans of your work and everything Cactus is doing. As an architect and technologist myself, I'm really smitten by this business and this line of work that you guys are in, where you're synthesizing data scientists and consulting and design and engineering and software into these, holistic solutions. It's a tremendous field to be in, I think. And so without getting too far into that, I'd love if you could, describe to our millions of listeners around the globe, and I'm exaggerating a little bit, but give us a little background, if you don't mind, on how you came together to launch Cactus.
Yeah. Well, I'll start off. I'm Noah Waxman. Great to be here. I'm one of the 3 co-founders of Cactus. Yeah. Marcelo is also one of the co-founders. My background is in product and brand and strategy consulting. Marcelo's background is in architecture, and our 3rd co-founder is Lucas Wertheim, whose background is in software and hardware. Basically, the 3 of us from our disparate backgrounds came together to start Cactus out of 2 beliefs. The first was that the world of digital product and digital space and the world of physical environments, physical spaces are converging over our lifetime. So we wanted to build a design studio that was able to design at that intersection, native to that intersection. So that was the first. And the second was this sense that increasingly in the world of consulting and design services, there was too much punctuation in the longevity of projects, right? So traditionally, maybe you would hire a strategy consulting firm or a management consultant to help you identify problems, a different kind of innovation design firm to help you come up with solutions, and then be hiring vendors or final line contractors like architects or interiors folks to actually execute on those visions. And that's just too many handoffs. So that's how we started the business.
Well, I'm curious, where did you guys meet?
So Lucas and I met at a graduate program at NYU, and we then fell out of touch for many years, went on our own ways from a professional standpoint. But basically, we ran into each other when I was bringing some clients through a installation at the Samsung store, which Marcelo and Lucas had designed and built. And in that moment, we kind of had this aha, like, wow, you're actually producing these things in these physical environments, very digitally connected.
What were some of the first projects? Did you go right into the healthcare space, or were there other initial projects that really got you started and got things moving for Cactus?
Yeah, so in the early days, Cactus was an experiment first. Would this work? Would it be possible to run a firm that effectively did digital product design and graphic design and brand and innovation consulting, business consulting, and also architecture? Would it work, right? And so in the early days, we had a thesis of the types of clients that we thought would want to hire us. Our thesis was retail, cultural events like concerts, openings, events, and cultural spaces like museums, big interactive display moments. So when we launched the business in the first year, we did get some work in each of those, and early projects ranged, everything from literally from concerts. HBO was a big first client of ours. And then right around a year mark, Cactus had started working with Mount Sinai Hospital. We were able to make this first project in healthcare with Mount Sinai that was just a smashing success, got a lot of accolades for that. And that really helped launch Cactus. The world of healthcare and health and wellness generally were really ripe spaces for specifically integrating digital design and physical design, specifically thinking end to end about a user, in this case, a patient or doctor or nurse, their experience with a product or space. And so that was just a fantastic first foray into healthcare.
So is this the Lab 100 project you're referring to?
Yes, totally. So we started working on that project. This is now, I guess we're at sort of the eight years ago mark, late 2016. It was the very beginning of sort of, quantified self was as a trend. People were starting to think about biohacking and tracking their own biometrics, but it was a tiny sliver of the population, tiny. Mount Sinai Hospital wanted to accumulate de-identified patient data for patients who were not sick, which is actually something that's pretty uncommon in healthcare, right? Very quickly in these collaborative sessions with the amazing team at Mount Sinai, we hatched this idea for a new kind of product, that's what I would call it, which is a physical space and a digital companion app that people would actually really, really enjoy, that people would really get excited about going to and then going back to. And we were able, over the course of the first few, let's say, many months, get enough funding to really launch the project, at which point I'll pass it over to you, Marcelo. We had this really incredible design brief, basically, rethink sort of a clinical model that's focused on data.
Yeah. So to explain this relationship between physical and digital, it's important to reinforce our relationship with the client, where the client arrived at this project with a giant question mark. So after several sessions, we start to draft and think what is the best engagement we can create with the patient. And what we did was to design a technology that's integrated in the space, like you are entering in a digital device. That's the idea behind. That's why the integration between screen and even the devices to capture data, they are mapped, they are positioned in the space to transform the space in a gigantic device. We take seriously the data collection. We see this as a crucial thing, and the space reflect this thinking.
So, Marcelo, maybe this is for you too. Did you have an idea early on about there's eight stations, I think, in the system? Yeah. 8 data points of gathering the cognitive data, the typical data you might get from doing blood work analysis and all that other stuff, just also physical cognition. I think all those data points, did those evolve over time?
So these stations, it's an easy way to communicate. You will run this path for the user, run this path, and this path we will collect data at this data. At the end, you will see a big picture of this data. But we can imagine in the future or over time, the station 3, instead to do a balance analysis, you do another type of analysis because there is a new device that we can capture data differently.
Maybe I'll jump in and kind of emphasize what Marcelo was saying. So we went in like good design researchers. And again, your listeners will relate to this. We went in and we were the guinea pig patients. We did all the tests. We got to talk to them about the tests, about the results of the tests, about what our results specifically meant, right? And in doing that, we learned that there's a kind of a typology of information that's going to be coming up here. One is, well, what is the thing? Is it a cuff? Is it a scan? Is it a blood draw? How are you getting information about me? Because that's kind of interesting. Usually you're not talking about or thinking about that with a doctor, but especially nerdy biohacker types are interested in this stuff. So it's like, what is the test? What is the data it collects?
And so looking back maybe a little bit, what do you see that may have been some of the more significant challenges?
Raj, the question gets at is like sort of what are the funny, entertaining anecdotes along the way of what we've learned where there's been mistakes, right? Which we all, of course, make.
Which you're learning from.
Totally.
You know? Yeah.
And there's nothing. We celebrate fail fast mentality.
Correct.
You know, it's a really important part of how we at Cactus think that like the biggest things that Cactus has achieved in terms of our maturity and how to get stuff done, especially in the healthcare, big H healthcare systems world, is first of all, a lot of times in the early days, especially clients would come to us and say, we've got this great building, and it's going to open in 6 months, but like we don't have any screen. Or where's the new thing, guys? Tell us what like the new thing is. We want it to look. It's just a little bit boring. Like, can you kind of spice it up for us? And that is actually impossible, is what I would say, because at that point you're just whatever budget you've got, you're going to buy the nicest TV you can and throw it up on the wall. And in the
flexible
end,
LED screen or something. And yeah,
you're probably making a mistake at that point, to be honest. Is what needs to happen is digital layer or product design or service design really needs to be a conversation that happens early on, preferably even before facilities budgets are set or specific projects are initiated, so that we can hatch a strategy that achieves the goals. The thing that's missing if you come late is the ability to really think about content, right? Content is what's important in these types of scenarios. When you're talking about a facility, if what you want, this is the Wellness and Wonder podcast, if you come to Cactus and say, look, I want my patients to have a sense of wonder about their body, even in a moment of pain or even in a moment of education and entertainment, I still want to instill wonder. Let's say that was the idea. In the end, tech, quote unquote, is not going to do that. What's going to do it is some story or some special power that you're giving a professional, like a doctor or a social worker or a nurse or a nutritionist, etc. Some special power you're giving them where the technology is a tool for them to do their job. Actually, what you want is for the tech, as much as it's possible, to completely disappear from your designs. You want people to leave having had this amazing experience and not thinking about the app, the microphone, the camera, the screen, the technology. You don't want them to think about any of it. You just want it to have worked really well. And you want the doctors or users, whoever they are, to just think, hey, this really works. The cool thing about that approach also is that it's often much less expensive for our clients.
I feel like the Lab 100 project, along with many others that you've done, illustrate this. This is not technology that was applied to a physical space. This was thought and conceived all together from the beginning.
Yeah, I want to reinforce this idea. What is the content? And I would do for architecture. If we, let's say that we will design a house. That's the first question that all of us architects or designers do. First, what is the content? What you need in the house? 2 bedrooms, That's the first question. But for some reason, time to time, for the digital perspective, the question, what is the content, come later and not before, come after. Like, okay, I have now on this lobby, this gigantic LED screen that I spent $2 million, and what I do with this.
Well, and I would think that each industry that you're serving, there's a broad category of industries, as Noah mentioned earlier, between retail and events and, healthcare. I would think each of the industries the technology is going to manifest itself a little differently. And at least in the healthcare space, Lab 100 seems to me to have just really been beautifully executed in terms of the balance between the two. What are some new things you're seeing in terms of sensory analysis, maybe cognitive, maybe physical, maybe vitals? Are you seeing some new things that are helping to impact new work that you're doing?
The coolest stuff that we see on the horizon is basically software layers on top of really high quality, but very well understood sensors. That's my answer. So what do I mean by that? Basically, if you've got a high quality camera or camera array, a high quality microphone or microphone array, and then some perhaps visual and audio outputs, speakers and a screen, for example, you can do pretty much anything with those. Those are the things that the environments of the future will have. And to give you some examples, there's already software on your phone which can use the camera to do things like detect heart rate, stress levels, and many other biomarkers. Marcelo, you'll remember more than me. In the future, that will be ambient sensing. A camera that you don't even notice is there in certain environments will be able to say, okay, Raj is stressed, or Raj didn't sleep well last night, or Raj's blood pressure is higher, or Raj's heartbeat is higher. It's wild to look at the arc of innovation of interpreting effectively camera data. In the end, I think we kind of know what the hardware for the next chapter is going to be. What's cool is the software layer, right? Because now you're starting to talk about interpreting that data using incredible software, using algorithms, and yes, using artificial intelligence, which we're more reluctant to use. I mean, specifically, large language models and self-learning systems when I say artificial intelligence. And those things are really good at, over time, for example, ambient listening. If you've got an AI-enabled system that can really hear and identify different parties in a room, can understand a conversation, and can then do things like automate note-taking, automate summaries, make suggestions, analyze likelihood of comprehension, turn things from conversations into next steps, which might get loaded into an app, which might follow you when you leave the hospital.
Right.
There's just so much potential there. And a lot of Cactus's work these days has to do with focusing on those potentials, basically the sort of crawl, walk, run of these types of opportunities. That's the stuff that I'm super excited about in the years to come.
One thing that excites us too is the relationship with this technology and the space itself, because we need to imagine and probably invent new environments to achieve these things. Like today, all the talks with a doctor will be in exam room. Should we name this room exam room? Is this more like a talk room, or what exactly is this room? Are we at the verge to create a new name for this space? In some moment, somebody created the bedroom, 600 years ago. But now we are at the verge to discuss the new names and even environments that we need to design to achieve this relationship between the healthcare system and staff and the patient. So again, like the invention of things, you have hardware, you have the software, which are moving super fast, all know, but the space itself will provoke us to create new environments. And maybe we need to name these new environments because they doesn't exist before.
Yeah, I really, really appreciate that answer, Marcelo, because I think you have to really hone in on that, how you're trying to use that exam room, as you're putting it, or note-taking room, or data analysis. You're now trying to analyze the data that you just gathered.
To emphasize what you said and what Marcelo said, so I do believe that the world of architectural design is going to shift a lot due to these technologies. If you take, for example, the fact that today, if I'm sick and I'm in the hospital, when the doctor's with me, they are distracted. They're looking at a computer. Their hands are on a keyboard. They are doing their job in the computer, and you're kind of there as a patient. You're kind of there as a specimen along the way to their data entry. That is something that automated systems will do. Okay, so now that room is different. That interaction is really different. I'm not, as a doctor, I'm not over here while I'm talking to you, typing on the side, trying to get as much data entered as quickly as I can so I can move on to the next. I can look at you, you can look at me, or we can look together at a screen or a tablet or a projection or listen to something. And actually, what should that be? Where should we be looking? And that's a really cool spatial and specifically furniture and specifically interior design question that we're all going to get to answer over the next decade. And so the way you build the room shifts and what happens in the room changes. And that's a really cool opportunity.
They have a client, today's project, Comprehensive Cancer Center. We cannot name for now, but there was a lot of discussion about the infusion therapy, like how to deal with the infusion. And we understood, we mapped all the steps and all the things. And one moment we asked why this should happen on this environment, because 99% of the infusion centers has different materials, different colors, but the logic of the space is the same. And today we are pushing for, hey, the space can be more totally different, because this will not change the treatment. This will not change all the safety rules. So, and we are applying this thinking in today's project, and we are applying new environments. And on this project, we have new names, by the way, for the spaces and for the objects, because these are not something that you go in a shop or in a retail. Oh, I need this object. Doesn't exist. We need to propose this new object.
Looking ahead, you've done this fantastic work with Mount Sinai. Great. There's a lot of interesting new technologies on the horizon. What are some things maybe on the boards? Some new projects that you're getting engaged with? Anything that you can you can talk about?
Actually, I'm really excited because these days, one of the things that's changed most about our business is how long these projects take to become public domain. So a lot of what we've been working on for the last 5 years has really been under the shroud of secrecy. But I can talk in general about them without naming names. Just to give you a smattering, there's a really interesting client of ours out on the West Coast that's asked us to think about the cancer, specifically oncology patient user experience, oncology nurse user experience. And that's a project where when you look at the way that infusion centers are built these days, it is based on, I would call them clinical and engineering requirements and not on the human factors by and large.
Wow.
The spaces and places where people are getting this kind of care really are not that comfortable, are not that useful, ergonomic for sort of a modern patient or a modern nurse or practicing doctor. And so we've got some really cool ideas about the future of the kind of furniture that are involved there, how tech is involved so that people who are feeling well, perhaps at the beginning of their chemo, for example, and want to get some work done while they're in the facility versus someone who might be really feeling quite sick. How do you want to occupy a space? What would make you feel most comfortable and most sort of adjusted in a well-adjusted environment? So that's a really cool project. It has a lot of spatial implications, not just digital. We have a client actually in the Middle East. This is a company that is funded in part by the government of the Emirates that is building a new healthcare facility and essentially a new clinical model for primary care and care focused on healthy longevity and increasing what we would call health span, right? Number of healthy years. And it's a really interesting project because it's essentially a public health initiative for the United Arab Emirates, where a very wealthy population is also in declining health overall. Life expectancy is decreasing as wealth increases in that country's recent history. And so how do you take a population which has very high expectations, but health literacy is relatively low? And how do you inspire them? How do you make something that people want to do? How do you make people understand what healthy habits look like and not make them a burden, but make them into a luxury even? And so there's a big facilities component to that, a big digital component, and a big service design component to that project. That's called the Institute for Healthier Living in Abu Dhabi. We also do a lot of work with Advent Health. Advent's a big health system in multiple states in the US. We focus in their Florida market, but we've worked with them on women's health, thinking about the user journey of moms from pregnancy through day of delivery through hospital postpartum and then longer postpartum journey. Really cool digital component to that, as well as a new type of facility, essentially a reinvention of the birthing center, let's say. We've also done some really cool work with Advent, integrating health and wellness into their digital experience in a pretty cool proprietary way. So that's coming up. And yeah, there's some other really interesting ones. We're working on a physical therapy company. It's a startup, basically a really high-end physical therapy and sports medicine practice, turning their practice into a digital product. We've also got, I guess this is the last one I'll give you because it's a fun one. We've been working with a robotics business that's focused on traditional on-bed Western-style massage, but being performed by these custom robots, which they've built, which are able to actually sort of map your musculoskeletal system and really provide very excellent massage. So Cactus has been tasked in that case with thinking about their physical environments. What are the physical environments in which these robotic beds get built? They have to be modular because some will be in retail showrooms, others will be in private settings, and others would be in, let's say, spas, hotels, even airports maybe. And so what's the physical housing that you would enter the room? So some really interesting projects that are going to finally be out in the public in 2025, and just really excited about the future.
Those are all so fascinating. I appreciate you giving us some insight as to what's down the pike. I mean, it sounds amazing. I typically like to end these discussions with, leveraging the wonderness of, the wonder term in our title of our podcast here, which you referenced throughout. If you had the perfect project, or if there was a project out there that really would get you so excited to work on, is there some technologies, some specific kind of facility that would be an amazing project? I think it seems like you've got an abundance of them.
There's a lot of things we want to work on, a lot. I am personally very interested in thinking about how higher education spaces will change in the near future and how transportation facilities will change, airports, train stations, subway stations, etc. I actually think that both of those are big categories of built environment that need to change in ways not totally dissimilar from hospitals. And so there's a lot of interest at Cactus in thinking about those spaces as well in the future. We've done a little bit of work in both, but no major projects at the moment.
That's cool.
Yeah.
We know how knowledge is changing so fast. So the educational layer vector will be important. Mobility, we know all the impacts on our previous decisions about mobility, roads and everything are impacting our health, and vice versa, the health. So these three vectors are in some way are the basics of community, and we would like to impact this.
Again, gentlemen, just tremendous work you guys are doing. You've got a wonderful and fascinating world ahead that needs to be served by you guys. And so I wish you tremendous success. Thank you for this, and be ready for us to ping you for a part 2 so we can do it again.
Thank you so much. Wonderful time. Thank you so much.
Noah. Thank you so much. Thank you, Marcelo.
Thank you.
Thanks, guys. This was really fun.
Bye-bye.
I'm not even sure how I can succinctly summarize everything we just heard, other than to just simply say that Cactus is really showing us when you combine empathy, data, and design, healthcare can become something entirely new, something that's beautiful, intuitive, and of course, deeply human. As Noah mentioned, their aspirations about looking at other sectors like education and transportation, I'm really excited to see how their work will translate to these industries. So, it goes without saying that they are up to some amazing, groundbreaking work, and it definitely warrants a part 2, as I mentioned. And speaking of groundbreaking design, next time on Wellness and Wonder, I get to sit down with Stephen Baker, co-creative director of an experienced design studio based in New York City called Local Projects. We explore their powerful work for Children's Healthcare of Atlanta and unpack how his team has used immersive storytelling within a sensory-rich space to create a very unique fantasy world of digital hybrid animals to bring comfort and delight to children and families from the very moment that they walk through the hospital door. Yes, I said digital hybrid animals, and I'll leave it at that. So again, just a quick plug about us. To learn more about everything that we are up to and how our team at Bialik is driving innovation in the spaces that we help bring to life, come visit us at www.bialik.com. That's BIALEK. And follow us on Instagram at Bialik Social. And as always, until then, stay curious, stay well, and keep wondering.